Hello, happy Monday and happy Halloween. Thank you all for being at Downtown Rotary today. Please join me in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Please join me in the four-way test. Of the things we think, say, and do, first, is it the truth? Second, is it fair to all concerned? Third, will it build goodwill and better friendships? Fourth, will it be beneficial to all concerned? I'd like to invite Brian Mulder up to do our invocation. While he comes up, I would also like to thank Brian for chairing our Monday Logistics Committee. He helps coordinate our greeter leaders and schedule each of our invocations. So thank you, Brian.
Pray with me if you choose. Father God, we do thank you for today in this gathering. Lord, we live in a great city, in a great state that provides plenty of health care for us. And so, Lord, we do thank you for our health. We thank you for the healthcare systems. We thank you for how they operate, how they bless this community with their philanthropy and just their willing to engage. And Lord, we just lift up those who are struggling with health. We ask that you bless them. Lord, we thank you for this, as I said, this gathering, this discussion today, and for this food. In Christ's name we pray. Amen.
I would like to now welcome our guests and those who invited them to be a part of today's meeting. I would also like to welcome our junior Rotarians, Leah Bosler from Lincoln, Raina Moss from Sioux Falls Christian, and speaking today will be Lena Vandewater from Jefferson. We will hear from her shortly. We have a number of Rotary business items to cover with you today. As Eric Erickson makes his way up, I would like to share my appreciation to the 50 downtown Rotarians who shared fellowship and some spunk at Tuesday's social, and a special thanks to Matt Dittmanson and Jennifer Hazing for their efforts in bringing such a fun experience to Rotarians. Now, Eric S. Erickson, share a little bit about Sioux 52.
Thank you, President Cindy. Good afternoon, fellow Rotarians. Sioux 52 is the one relevant it that you as downtown Rotarians have chosen to focus all of our outside of this day efforts on. And Sioux 52 is a reminder for those who don't remember, was formed about 2 3/4 years ago in collaboration with the City of Sioux Falls and the Helpline Center as a way to encourage businesses throughout our great community to encourage their employees to get out and mentor. And not only to kids. I know a lot of times when we think about mentoring, we just think about going to have lunch with kids at school, but there's so many different kinds of folks who need mentoring, whether they're just coming out of prison or if it's somebody who's maybe confined to their home and just needs to spend time with someone. The efforts of Sioux 52 are to encourage a community of mentors to make our community better, building community one relationship at a time. So the brand is still alive and the effort is still alive. As you recall, we got a little bit restricted in what we could do a couple of years ago. Well, we've reformed our Sioux 52 steering committee. We've had a couple of really, really good meetings. And all of that, much of that has been to discuss what we've done since the last time we tried to recruit businesses into Sioux 52. In the past, if I came out to your business and said, would you be a Sioux 52 business partner, and you said yes, we'd say, great, call 211 and let us know how it goes. And that went all right, but we realized that we needed a coordinator, someone who could continue to steward that relationship with you and to help answer questions about how you can continue to be a business partner. So we've established an MOU with the city and Helpline Center, and we hired Emily Van Gorp, that works at the Helpline Center. Half of her time is dedicated to be the Sioux 52 coordinator, and she's done a tremendous job in the 6 months she's been here. She's developed an onboarding kit to welcome business partners and a maintenance kit too. She'll be doing quarterly newsletters and some things like that, with our business partners, and I think it's going to be great. We've already had really good input, and thanks to those of you who responded to the survey that we sent out asking how we can do better. So the next thing we're going to need, now that we have a really, really good system in place and we're gaining momentum again, is recruiters. In the past, when Tony
Everyone to consider that opportunity. What a great way to get out and represent downtown Rotary, Sioux 52, and stay connected with other business leaders in our community. We have not one, but two member inductions today. Our first, Alan Turner II, will be introduced by Joel Sylvester. Joel.
Thank you, President Cindy. Welcome, fellow Rotarians. It is my honor to introduce Alan Turner II to Sioux Falls Downtown Rotary today. This is actually Alan's 4th Rotary Club that he'll be a member of. I'll let him kind of go through his history, but what I will tell you in the time that I've gotten to know Alan is he has been all in on the Sioux Falls community, has asked me great questions, looking for ways to get involved. Brought up Rotary, I think, the first time that I ever talked to him from that event. So super excited to introduce Alan.
Well, I just want to say thank you. Like Joel said, this is the 4th Rotary. I've had the privilege of serving United Way in various states in Tennessee, Alabama, and Florida, and all those areas, serving with Rotary as well. And they were always the leaders that found what needed to be done and got it done in the community. So I think I was here for 2 weeks before I was up on stage talking to this group saying, this is the Rotary you have to be involved in. So I just want to thank you for the opportunity to serve with you, and I look forward to many years. Thank you.
Our next induction will be done by Dean Karski, Madeline Miller. Dean.
Thank you, President Cindy, fellow Rotarians. About 2 years ago, I met a very delightful lady. Her name's Madeline Miller. She is the clinic manager or nurse manager for the Link right down the street. And here recently got to talk to her, and I said, you know, Rotary's right down the street. It'd be a great club for you to join. So that's how we ended up with her here. She impressed me from the beginning, but her passion for her work is what will impress you also. So I'm going to let Madeline Miller, Maddie, introduce herself to you. So welcome her.
Hi, everybody. It's really great to be here. It's just really an honor to be included in this group. Dean, thank you so much for your kind words. I, too, have been so impressed not only by you and your leadership in the county, but also by the leadership of our board members that have really come together to support the Link. I never thought in my nursing career I would engage in something that was so community focused, but now that I have, I've just found myself wanting to crave more opportunities to learn more about how to serve our community. And when Dean invited me to Rotary, I really didn't know what to expect, but I've just been overwhelmed with the education, with the relationships, and I'm just so excited to be here with you all. So thank you.
Next, I would like to invite Joni Ekstrum up to introduce our junior Rotarian.
Good afternoon, everyone. I have the pleasure of introducing you to another exceptional student from Sioux Falls. Today, we will hear from Lainey Vandewater from Jefferson High School. Lainey is involved in student council, show choir, jazz choir, concert choir, FCA, Cancer Awareness Club, National Honor Society, Best Buddies, Reading Buddies, Student Ambassadors, and the Link Crew. And she goes to school too. My goodness, this is awesome. She also works by nannying 2 kids and loves to hang out with her friends, travel, read, and bake. Her parents, Justin and Jamie, are here. Welcome them. Thank you for joining us. And she has a number of siblings, some that are in college and others in middle school and high school in Sioux Falls. She does plan to attend USD, maybe, but might be able to be swayed if anyone has other ideas for her. She'd like to be a business major and is looking to see what that career will open up for her in the future. The donation that Rotary will give to her school is going to the Student Council, and we're excited to welcome Lainey to the stage.
My whole life, I've been told I can be whoever I want to be. Practically every adult I've ever encountered has told me that my future is bright and that I will do great things. Now, my issue isn't that I don't believe them. In fact, I want nothing more than to do great things with my life. The issue I've always had is knowing what I want to do. I tend to feel as though no job encapsulates exactly my dream job per se. But then again, I don't really know what my dream job is either. When I was in 8th grade, my sister was a junior in high school. She was involved in our school's show choir, as I am now, and every year at the end of the season, they would put together a slideshow of all the graduating seniors and what their plans would be for the upcoming years. When I watched this, I remember being so excited for my senior year because by that point, I would have my life all planned out and know what I wanted to be when I grew up, right? Wrong, because I am now a senior and do not know where I'm going to college or what profession I want to pursue. However, being involved in groups such as Student Council and National Honor Society, I've discovered a true passion for helping people and striving to better my community. 2 days ago, I had the opportunity to serve in Sioux Falls by volunteering to rake the town. We went to people's houses who had needed help raking their yards, and although it may have been tedious work, it was worth it. At one house we went to, the man who lived there, James, had recently broken his back and had surgery on his knee. So being able to clear up his yard for him was so rewarding. Being able to come to these meetings and hear all the ways you want to better our city is very inspirational, and I hope to someday be able to fill your shoes. Through these amazing experiences I've had, I've learned that what I want to be when I grow up doesn't have to be an occupation. When I grow up, I want to be remembered. I want to be generous, kind, dependable, and loving. I want to help people any way I can. So no matter what job I have, if I can accomplish those goals, I will be content with my future. Thank you.
Lainey, I think you can't go wrong with any South Dakota school, and I certainly hope you stay in South Dakota and continue to make it a better place for all of us. Thank you so much. Now, on to our program, Medicaid Expansion. I will invite our guests to come on stage, and as they do, I shall read a little bit about them. Kim Malsam-Rysdon currently serves as Vice President of Public Policy for Avera Health. Prior to this, Kim was the Cabinet Secretary of the South Dakota Department of Health for 7 years, including during the COVID-19 pandemic. She also served as Secretary of the Department of Social Services and Senior Advisor to Governor Dennis Dugard. Kim chaired the Governor's Primary Care Task Force and the South Dakota Healthcare Solutions Coalition, which expanded telehealth services, substance abuse services, and access to primary care to people across the state. Jim Bolin taught history and government classes in Canton for more than 20 years and is a graduate of USD. He has been involved in elective office for almost 20 years as a city commissioner and mayor in Canton, and for the last 14 years as a state legislator. He is currently seeking his 4th and final Senate term in 2022. Jim is married to his wife, Ruth, has 2 grown sons, 2 daughters-in-law, and 4 grandchildren. Today's moderator is Downtown Rotarian and board member Joni Ekstrum with South Dakota Biotech. Joni, thank you so much for coordinating today's conversation and program and for moderating.
You're welcome. Thanks for having me. Happy Halloween. You know, I thought about calling you guys and seeing if we should maybe coordinate costumes, but this is a serious conversation. I thought maybe that wouldn't go over so well. So today we're going to start by just reading the explanation of the Medicaid expansion from the AG's office. And then Kim and Senator Bolin will be talking about their different viewpoints. We do have both sides of the aisle here being talked about so that you can learn more about it from each side. So bear with me while I read this. Medicaid is a program funded by the state and federal government to provide medical coverage for low-income people who are in certain designated categories. This constitutional amendment expands Medicaid eligibility in South Dakota. It requires the state to provide Medicaid benefits to any person over 18 and under 65 whose income is at or below 133% of the federal poverty level and who meets other eligibility requirements in federal law. For people who qualify under this amendment, the state may not impose burdens or restrictions that are greater than those imposed on any other group eligible for medical assistance. Now that we've done that, we can go and have a conversation. So South Dakota is one of 12 states that have not yet expanded eligibility for their Medicaid programs, and the only state where voters will decide in November to do so. My question to each of you is, can you describe who is eligible for this coverage? Kim, you want to start?
Sure. So thank you for that explanation. The Legislative Research Council, which is the nonpartisan professional staff that advises the legislature on policy issues, has estimated that about 42,000 South Dakotans who are mostly working, who are low income, would qualify for Medicaid in the state. These are moms, farmers, ranchers, near retirees, people working in small businesses, and they are located across our state. The majority are without insurance or without health coverage today. And so Medicaid expansion would provide them with that coverage, not cash benefits. Some people kind of hear this and say, oh, it's a handout. It's not a handout, it's health coverage. So 42,000 hardworking South Dakotans across our state.
Jim, would you have anything to add?
Yeah, well, I don't necessarily dispute what Kim said. And by the way, this is our third or fourth time we've done this. So sometimes we just call this the Kim and Jim show.
I feel bad that I'm kind of turned this way. Sorry.
Okay. But I think everybody needs to understand that Medicaid expansion, part of Obamacare, passed in 2010 on a totally partisan basis by the Congress of the United States. All the representatives in South Dakota who went to Washington in that time, both Democrats and Republicans, voted against it. It will cover that many people, but it does come at a cost. And I want to emphasize that for the first 2 or 3 years that this will be out there, the cost is very minimal because the federal government wants people to buy into this. But there are 12 states that have not, and this is the last state, South Dakota, where it will be decided by a public vote. 4 of the top largest states in population in the state, in this country, are not buying into Medicaid expansion. Those are Texas, Florida, Georgia, and North Carolina, because they know that down the road there will need to be a tax increase to pay for this. So there is no funding mechanism here. It's going to cost eventually, after 2 or 3 years, about $25 to $30 million, and that's not counting the 8, 9, 10% inflation we're experiencing right now, which will be added on to the cost of this in the future. So there will be more. There will be more eligibility for coverage. Please keep in mind as well that not all doctors will take Medicaid patients because the reimbursement rates are so low. Just keep all those things in mind. If you don't mind a tax increase down the line sometime in the future, probably a good idea. But if you do, it will. That's what you're looking as we face the future. I'll leave it at that.
So if we might just talk about cost real
Sure.
quick, let's because that is a big question I know folks have on their minds, and so I just want to level set this a little bit. Medicaid expansion is paid with 90% federal funds. So 90% of the bill at the end of the day is paid by the federal government. That leaves just about 10% needing to be paid by the state government. So that's obviously a very generous federal offer. As Jim indicated, there's also some additional federal incentives for new states that expand. And so when LRC, again, the Legislative Research Council, was sorting out what kind of impact would Medicaid expansion have in our state, they really felt like we needed to look out for the first 5 years to really see what that would look like. And in total, the state cost of Medicaid expansion for the first 5 years, again, all of those years together, is $3.8 million. That's to draw in over $300 million per year of federal funds. So $1.5 billion paying for healthcare for a state cost of $3.8 million. So certainly in the first 5 years, it does look different. So what happens after that? After that first 5 years, the state cost, when you net out some of the savings the state would see from things that we're paying for with state funds today, it's about $22 million per year. And again, that's coming from LRC. That's not us independently kind of coming up with these numbers. So $22 million a year, that's, what perspective should we look at that with? Well, last year we had $115 million in additional state revenues that we put into reserves. The year before that was $85 million. And if you look at the 10 years before that time period, we had over $18 million on average of additional general funds that we put into reserves. So the other thing that the fiscal note doesn't even include is the sales tax impact from having $322 million of healthcare being used in our state, which is used to pay salaries for providers, it's to buy supplies, it's to do things that healthcare does. That has a tax implication, and we'll see additional tax revenue as a result. In fact, when we looked at this, I just saw Governor Dugard here, and we did some of this work a few years ago. When we were looking at the sales tax impact back in 2015, 2016, at that point we estimated it to be just shy of $9 million per year. So more funds in our economy creates more tax funds from our tax base, and that would be netted off the overall cost of Medicaid expansion as well. So we can afford Medicaid expansion without raising taxes, without cutting services. We can do it within the context of our current state budget.
If I could just respond to that.
Yes. You might not get another question in.
I would also like to point out that currently both candidates for governor, Democrat and Republican, have said that they are committed to removing the sales tax on food. And the LRC has said that will reduce state revenues between $100 and $120 million per year. I take both of them at face value that this is something they're going to push for in the next, whoever gets elected is going to push for that in the next legislative session. So when we hear these nice numbers, that's great if we're going to maintain, if everything's going to stay the same. I will also tell you, I've been in the legislature for 14 years, and I remember back in 09, 10, and 11, more than 10 years ago, when revenue was starting to shrink in the state of South Dakota. Please keep in mind, Medicaid, the bill for Medicaid will be paid before any teacher in the state of South Dakota is paid, before any correction worker is paid in the state of South Dakota, before any other bill is paid. The Medicaid bill, because we're in conjunction with the federal government, it will be paid. And then we'll wait and see, do we have enough revenue? And I believe as we look down the future, we look in the future, we're not always going to have these good times. This federal money is masking a lot of problems out there. Last thing I'll say on this subject, keep in mind, we have a federal debt, $31 trillion, with interest rates going up, and that will be financed some way. And I don't want to obligate us at the current time to another bill, which is going to come due in a few years. I'll leave it at that.
I'm going to ask. It's my turn.
Okay. Okay.
I have a follow-up question to the eligibility. So you're right. The South Dakota Legislative Research Council does predict there are 42,000 eligible enrollees in South Dakota. So if we look at neighboring states that have expanded Medicaid, what are their enrollment numbers? For example, North Dakota, the pre-pandemic numbers show 30,000 potential enrollees, yet historically they've only had 19,500. With this data, what do you think South Dakota enrollment looks like post-pandemic? Jim, you want to start?
Sure. It's possible that's an estimate. That's the best estimate. I don't necessarily dispute that number. It might be less. North Dakota saw less. Other states, perhaps not geographically close to South Dakota, have seen higher enrollment numbers than they anticipated. So we don't know. One other question, one other point to make is that some people are dual eligible for Medicaid and Medicare, other issues like that. That may impact those numbers as well. But I'll let Kim comment on that.
Yeah, I mean, I think the LRC numbers, just to kind of give you a sense, again, contextually about the 42,000 eligible number, that's about 8% of the total number of people in our state between 19 and 64. So that's the eligible population. So 8% of that total population. So to kind of level set, like, what does that really look like, and how can we, maybe compare that to something else that we know? Today in Medicaid, pregnant women are eligible for coverage up to that same income level. So they're eligible up to 138% of the poverty level today. And lo and behold, back in 2020, which was the latest data we could find, 904 women were on Medicaid for pregnancy coverage. That's 8% of the births of our state. So I think we're very comfortable that the LRC number is not necessarily overstating it. If you were to look at the experience of North Dakota, we'd actually see fewer people. If you extrapolate their numbers and their experience, it gets down to about 30,000 people.
Thank you. We've talked a bit about costs, but you guys, a lot of numbers out there, so I'm going to just back it up just a minute. So there are many estimates about the ongoing costs of South Dakota, but what are the real numbers this could potentially cost the average South Dakotan?
Well, I guess, again, I'll contend that we can afford to pay the state cost of expansion without raising taxes, without cutting services or programs. The experience in the 38 other states that have expanded are wholly positive on their state economies. So Kaiser Family Foundation, they do a lot of health-related research. They've looked at over 600 studies, which is amazing, of what has happened in those states that have expanded Medicaid. And every single study that looks at the impact on state economies are positive, because you see less uninsured people. And I just want to kind of get into that a little bit. We know that people that have healthcare coverage are more likely to get preventive care, and I think that intuitively makes sense to people. We know that they're more likely to have better management of chronic conditions like diabetes and heart disease. We know that they're less likely to use the ER for regular care, and they're more likely to get cancer screenings. In fact, in South Dakota, people with insurance are twice as likely to get breast cancer screenings. I'm looking at Jen Follier, who knows these numbers way better than me, and 3 times as likely to get colorectal cancer screenings. So when you think about that benefit of having health coverage, that makes its way back into our state's economy, because we've got less uncompensated care that helps rural hospitals. We have lower health insurance rates for private coverage. In fact, that was another study that Kaiser pulled out. We see health insurance rates drop 12 to 14% in states that have expanded Medicaid because their pool of uninsured people is less. So all of those benefits, I think, are really things that people have to take into mind when they're considering Amendment D. Obviously, it's very, very good for the hardworking people who would get coverage, but there is that economic benefit, and we can afford to do this without raising taxes or seeing services be lost.
I'll just comment on that. If all of her assertions are accurate, and I have great respect for her, if all of her assertions are accurate, why are Texas, Florida, Georgia, and North Carolina, 4 of our top 10 states in population in the United States, why are they rejecting Medicaid expansion? They obviously care for their people. They think about it. They know that down the road, if we go down this road of Medicaid expansion, which is 133% right now, it might be eventually somebody might want to move it up to 150. They will face a tax increase in the future to pay for the extra, for the benefits that are being out there. I'll just leave it at that.
Thank you. So Kim, you talked earlier about the federal match, the 90% federal match under expansion and how it will save the state some money. Are there any additional savings that could be found by expanding Medicaid?
Sure. So, kind of again, going back to the estimates that the Legislative Research Council put out there for voters to be able to look at, it does include savings of about $11 million per year on things like inmate health care. So today when folks are at the prison and they need to go to the hospital, the state bears the entire cost of that with state general funds. And so in the future, that group would become eligible for Medicaid and would have Medicaid participating in the cost of those services. So a lot of those savings are baked in. But what we don't see are savings to counties. So today, when a person doesn't have health care coverage and they have an emergency or they just need, they're sick and they need help, the county will often be a resource or can be a resource for those folks. And so that would be a savings to governments in our state that would not be reflected in that fiscal note as an example. But certainly we would see some people that are on Medicaid today move over to the Medicaid expansion population and get that, better federal match rate as a result as well.
And my only comment on that, I don't disagree with her in the sense in regards to prisoners and people, but please keep in mind this whole process, which started way back in 2009, 2010, was all designed to try to have more federal control, more federal power over the medical system here in the United States. There was this huge debate 10 years ago, and now it's the waves of this are finally lapping up on the shores of the state of South Dakota at the present time. And if you want more and more federal control, which is reflected by federal money on all of these different programs, this might be something you want. But if you have reluctance to go down that road, because I've been there when we didn't have any money, and my good colleague here, she kind of thinks it's always going to be this way. We got all this money and all these resources. I don't think it's going to be that way all the time. In fact, I know it won't be that way all the time. And I'm not going to vote for something that could potentially result in less money for schools here in the state of South Dakota, both at the regional level, at the K-12 level.
So I'll just share maybe another perspective on, where the Affordable Care Act came from. And that was really to address the fact that we, in our country, and certainly in South Dakota today, have a lot of people that are caught in the middle. So again, remember, the majority of people that would be covered by expansion are working. But they make too much to be on Medicaid today. They don't make enough to go to the exchange, which seems ironic, but that's the law. And so they're caught in the middle. They can't get insurance. Their employers don't offer it. It's expensive. And so the Affordable Care Act was a way to really address that issue because we haven't been able to address it any other way. And so that's really where this comes from. And that's the decision point that we all have get to make as South Dakota voters is, is this the right policy to ensure that people caught in the middle actually have health coverage, have a chance to have better health? The other point I just want to make sure that we don't lose sight of is what we've seen in other states. And back to, Texas and Florida and those states, I can't even fathom why they haven't done it. But what we do know from the 38 other states that have expanded Medicaid is that people actually work more and not less. And I think that's really important because, all of us as employers are just scrambling for workforce these days. Why wouldn't we try to leverage the existing workforce that we have? And if they're healthier and they can work more, that's been the experience in those other expansion states.
I'll just pass on that. That's okay.
So if you've been paying attention to the news at all, you'll notice the layoffs at the hospital systems. Would expanding Medicaid help offset those skyrocketing expenses that the healthcare systems are facing these days?
I mean,
not like a loaded question.
It's possible. I mean, you've got if this is approved by the voters, you will have this large injection of federal money coming into the state. Could that potentially keep someone on the job at Sanford or Avera or Monument someplace or at at another hospital someplace. I think there's an independent hospital up in Sisseton at the present time. That's all possible, but I don't know if that's if that would be a decision that employers and people, the hospital boards would make. I don't think we can say for sure, but it's possible.
Yeah, so I mean, expansion really helps on the revenue side of the equation, in that it really it helps fill the gap where we have uncompensated care today. And so, you know, when people present at the emergency room, they get treatment regardless of payer source. And if they don't have a payer source, that's called uncompensated care. And there's millions and millions and millions of dollars of that happen every year. So Medicaid expansion helps with that issue. That happens to be really critical for our rural hospitals. And, you know, I know sometimes when you're in Sioux Falls, you go, well, what do I care about rural hospitals? You know, it's really important that we have a system of healthcare services in our state so that people can get care as close, you know, to home as possible. Because when that's not available, they're coming to Sioux Falls and they're taking beds that maybe they don't necessarily need if they had a local option. So rural hospitals very much stand to benefit from Medicaid expansion, and that's why you know, they're on board along with a lot of other groups supporting this effort.
I just have one question because I want to make sure I have time for the audience, because I know that there's a lot of people wondering about this. And while we have the experts here, might as well let them ask. So what options are there for people who are below the federal poverty level and who don't qualify for Medicaid according to South Dakota rules?
Well, first thing I'd like to say on that is that this has nothing to do, I want to emphasize again, this has nothing to do with children. Back in the 1990s, Congress passed what was known as the CHIPS Act, which provided quite a bit of medical coverage, or an extensive amount of medical coverage for children. And this whole controversy here, and the issue has nothing to do with kids up through the age of 18. This is a select group of people, fall between the poverty level and 133%. Working adults in that particular area, able-bodied people, and the question comes down, what type of, are they going to have medical coverage? How's this going to be paid for? A host of issues there that have to be confronted with. As far as, you know, right now, people do go to the emergency room, and people do access care in a number of different ways. Sometimes people don't necessarily take advantage of their particular situation. But it still comes down to the question, do you want to continue down a road where the federal government has more and more power, control, and authority over healthcare in the United States? Because that's the road that, I'll just say, that's the road that Bernie Sanders, Elizabeth Warren, and a number of other people want. They want a government-run healthcare system, and this is just another step for more people to be under that type of a system. I'll just leave it at that.
So, you know, to the question about what happens to people today and what other options do they have, you know, again, folks that don't have healthcare coverage don't have a lot of options when they present at a healthcare provider because they need it. Sometimes the county poor relief will be a resource to them. Other times they're presented with a bill that they really don't have, you know, they're not going to be able to pay. And so, you know, to the extent that medical debt is the number one reason families go bankrupt in our country, having healthcare coverage is the number one way to avoid that. And so, you know, folks that don't have coverage just don't have a lot of options. Some states provide more options that are kind of state funded. That's not the situation that we find ourselves in South Dakota. So expansion just really helps fill that gap.
Okay. I'd like to open it up to the audience to see if there are any questions out there. Oh, hands go up. The microphone's coming your way.
Hi, Dave Kapaska. Appreciate the presentation. I'm going to approach it a little bit from the healthcare side, since that's where I lived for a long time with a lot of my friends here. And first of all, number one, since 38 states are having Medicaid expansion paid for by the federal government, our tax dollars are paying for 38 other states. and not our own. So that's reality today. Number two, I read a study years ago and then updated it not long ago that the 13 richest per capita countries in the world, US, Canada, Australia, England, and most of Northwest Europe, compared the health systems. We spend the most, and I'll tell you, we have the finest equipment, the finest people, the finest everything. But we are last in population health outcomes. Not because of you and I, most of us in here are the haves that we get to go, but the have-nots and those fetal demises, the moms that die during pregnancies and such because they haven't had any prenatal care, the cancers that come about where they haven't had any care, those people go into our data and bring that down. And so, and so we're last of those 13, despite spending the most. And second, South Dakota is 36th in the country compared to all the other states. Now, when there's 38 other Medicaid expansion states, maybe that rings. But my question, Senator Bolin, first at least, is so if not, how do we deal with the have-nots, if you would, that bring our health that we invest so much into down to last? Period. Thanks.
I'll just say this, and I'll just say this too, as a person who's been blessed with good health essentially all my life. There needs to be, I would say, at the K-12 level, there needs to be a concerted effort to work on diets and health care for young people in particular. I don't, try to have as much preventative care as possible. I think we need to continue to do what we can to try to reduce the rate of smoking, these type of things, tobacco use. But ultimately, the question really is, how much control is government going to be able to exercise over the lifestyle and the choices that people are going to make in a free society as to their healthcare decisions? How much, and are we going to in the desire for good health for everybody, are we going to create a system where the government has power, control, and authority over all of these questions out there and is going to pay for all this stuff? Because once they start paying for everything, they will have power and control to dominate things. I guess that's my best answer for this right now.
So, I think it's important to remember that Medicaid coverage is healthcare coverage. And so what a recipient gets is a way to have their appointment with their primary care physician paid for, that we know helps people get to the doctor before small problems become big problems. So I disagree on the government control aspect of that, in that the government's a payer, but they're not dictating how people use healthcare coverage and diet and stuff like that. But Dr. Kim Paska, I think, a really, really important thing to know, and again, because 38 other states have expanded, we have the benefit of that. Those states have seen a 3.6, I gotta make sure I get that right, 3.6% decrease in all-cause mortality. And so if you want to look at population health, the first thing you look at is, are people dying at a higher rate in one group versus another? And we know we see racial disparities, we know we see disparities, across other lines. But think about that, a 3.6% decrease in all-cause mortality in states that have expanded Medicaid. That means those states have fewer people dying. The other part of that number is that of that, 1.9%, which doesn't seem like a lot, but if you're thinking of thousands of people over the course of time, it equates to a lot, decrease in healthcare amenable mortality. That means people going to the doctor and not dying. And that's the benefit of seeing people have healthcare coverage. And I would hope that everybody in this room would say those are good things for people across our state. Fewer people dying early, people going to the doctor, getting the care they need, and not dying as a result.
Thanks for being here. My question is, At the federal level, most recently, of course, the Inflation Reduction Act was passed, and I believe there was some Medicaid, maybe Medicare provisions there. Could either of you speak to that? Are you aware of that, how this would affect possible eligibles? Because I was once told, or I thought I read, that some coverage now extends through that and doesn't put the burden on the state?
I can address that.
Go ahead,
Yeah.
and then I'll make
So what you're referring to are the subsidies that are provided to people that are able to buy health insurance through the exchange. And so again, the thing that's weird and kind of non-intuitive is the fact that if you have income less than 100% of the poverty level, you're not eligible to go to the exchange. So that's why we've got the gap, and that's why we've got the group of people in the middle who they're working, their employer doesn't offer insurance, but they don't make enough to actually go onto the exchange. So what you're referring to is the fact that subsidies on the exchange were extended at a higher level.
My only comment, sir, is that the bill labeled the Inflation Reduction Act, I don't think it's going to reduce inflation at all.
So my question is, so what do you say to the potential 42,000, and this is, I think, for you, Senator Bolin, working poor that are working maybe 1 or 2 jobs, maybe have 1 or 2 children that can't provide health coverage for themselves? What are their answers?
You know, this all comes down to a concept of who's responsible for health care in the United States and who's responsible for all of these issues and the financing of all of these things. I mean, I suppose we could say that the best thing to do is just to create a gigantic government system that will benefit everybody and have government control over everything. Because there's no guarantee that if we go to 133, 5 or 6 years from now, 10 years from now, we'll say, people will say, well, we got to go to 150 to get more people covered, or we got to go to 200% to get more people covered. There's nothing magical about the 130 from the 100 to 133. I mean, the question really comes: is this what you want? Do you want more money coming from the federal government with a $31 trillion debt that will have to be financed somehow as we look out over the future? That's a fundamental question, and I'll leave it at that.
So another way to maybe think about that argument is, you know, we can choose to continue to pay our federal taxes and send $300 million worth of our federal tax dollars to other states that have expanded, like New York and California, or we can choose to expand and keep those federal tax dollars here, working on behalf of people that don't have other options. And we know that's good for them. It's good for their health. It's good for the small businesses that employ them. It's good for rural hospitals. But mostly, you know, those 42,000 that are just caught in the middle, they really do stand to benefit from expansion.
Ms. Ekstrum, thank you for moderating. Secretary Malsam, Senator Bolin. This is maybe a process question, but you know, we're all getting mailers on both sides. Bryce Healy, I'm sorry. But more of the process question. So we hear that, and I represent an organization that is very concerned about the federal government's continual payment for the portion. I've recently heard that in order for the federal government's portion not to be continued paid, Obamacare or whatever we want to call it would have to be repealed. So A, is that true? And secondly, what's the likelihood of that happening since it did not happen a few years ago?
So I'll maybe start.
Go right ahead.
Okay. So thank you for that question. So process-wise, the 90-10 federal match that is part of Medicaid expansion is in federal law. So it would require Congress to change that. Incidentally, the current Medicaid program constructs are also in federal law, and those have been in place since 1965. So we do have a long history of having a state-federal partnership relative to Medicaid in our country. And, you know, to the degree expansion has, you know, became an option for states over 10 years ago, early on, there were several attempts at the federal level to try to repeal that. We thought, when the administration changed here, when President Trump was elected, that we would see potential more action in that arena, and not once have we seen a bill, make it through to actually change that structure. So, I mean, I think the tide has come and gone relative to this being well established over the last 10 years, 38 other states relying on it to cover their populations. And we haven't seen a federal bill come forward to try to change that now in the last several years.
And I would say that it's probably not, there isn't a big effort in Congress right now to make some kind of an adjustment in this. But I would also say that originally, when the first bill came forward, before amendments were brought to get more people to vote for it, the idea of Medicaid expansion was just going to rely on the old formula between states have to pay between 33% and 50%. But for Obama 10, 12 years ago to get this thing passed, he had to sweeten the pot a great deal. And that's why we have the 90-10 split at the current time, with states still having to pay 10%. Again, a state like South Dakota, $25 to $30 million when the bill hits in the future, whereas the federal government's going to keep paying this incredible amount of money. Question remains, can they continue to do that on an indefinite basis? That's my big concern.
Okay. Go ahead. We have time for a couple more questions.
All right. So thank you so much for both being here. This has been great questions. I was wondering if you could hit a little bit more on how this affects rural South Dakota. We've talked a lot about a lot of things here, but most of South Dakota is rural, and you hear a lot of things about how nursing homes are going to shut down and access to rural health care and things of the sort. I honestly have no idea. So if you could both go ahead and talk a little bit more on that, about how this affects rural health care.
I'll go first. First of all, to the best of my knowledge, this has nothing to do with nursing homes, or if it would have any impact, it would be very, very minimal as far as nursing homes are concerned. That's a totally separate situation. As far as your rural hospitals and things like that, to the best of my understanding and best of my knowledge, there are once you qualify to be between 100 and 133%, you go on the exchange. You can't get a subsidy as far as your health care is concerned. You either have to pay the whole bill yourself, or you just have to be on Medicaid. So I think there's at least a reasonable argument to make that some people who will be paying will be forced off of private plans onto Medicaid, and that could actually cause more damage for rural hospitals in certain areas of the state. I think there's at least a reasonable possibility of that. But again, I want to emphasize this has really nothing to do, the discussion we're having here has nothing to do with nursing homes. That's a completely separate situation. And this is not going to be a panacea for rural hospitals across South Dakota.
So the rural population, more likely to be uninsured. And so that's a fact, and more likely than, therefore, to benefit from Medicaid expansion because they don't have coverage today. What that does is it really helps rural providers, which is more than just hospitals, so that they've got less uncompensated care that they're having to write off and try to make ends meet. And so it really does have a benefit to rural hospitals. That's why rural hospitals support Amendment D, along with other providers and healthcare just more generally. Again, we want to see people have coverage so that they get preventive care, take care of their health issues, remain healthier. One other way that this really impacts rural providers is, imagine a community where you pretty much know everybody. You go to the grocery store and you bump into pretty much, everybody you see there is somebody that you know. When you're the provider in that community and you see people not being able to take care of their health, that has a tremendous toll. And so, in rural parts of our state, it really is about taking care of your neighbors and your community when people have coverage and can be healthy.
All right, one more question. Is anyone? All right. Well, thank you. You followed the four-way test, even though we were on opposite sides. I do appreciate you providing all of this information. Hopefully, it gave some clarity to those in the crowd here. So please, can we help me thank Kim and Jim?
I would like to echo the gratitude and the sentiments for having you both here. And thank you all for listening and for being a part of it. And it was fun to get to take some questions from the group. And so I enjoyed that aspect. Joni as well, thank you for incorporating that in. Looking ahead to November 7th, we will be celebrating Veterans Week with a program on collaborating to improve the lives of veterans. With that, Rotary is adjourned.
The bell. Thank you, Jim.
Good job as always.
Take care, my friend.
You bet.